Hello, everyone. Thank you so much for being here today and welcome. I'm Jodi Smith. I'm the Director of Strategic Alliances here at WomenHeart, and I'm so excited to be here with my friend, Robyn Peacock, who's the Director of Patient Engagement at Heart Valve Voice US. And she is also one of our incredible WomenHeart champions. So today we are going to share about our experience participating in the Heart Valve Disease Council of Global Heart Hub. Global Heart Hub is a global alliance of patient organizations working to elevate the patient voice in cardiovascular care. And in addition to being in the council meeting, we also had the opportunity to do 3 days of advocacy training at the Bocconi University. The Heart Valve Disease Patient Council is a really great group of people. It's a wonderful council, and it's focused on improving outcomes for people living with heart valve disease. And this meeting brought together patient advocacy leaders from all over the globe. There were a lot of different countries represented, about 20, I think, maybe even a little over that. So that was really great. We had some from Africa, all the continents, I think we had, except for Antarctica.
That's right.
Yeah, that was great. I have been on this council for many years now, and I was able to represent WomenHeart, and Robyn was the representative for Heart Valve Voice US. There are other Heart Valve Voices around the world, and there were representatives there of those Heart Valve Voices too. And so today we're just going to share a little bit about what we learned, how it's shaping our work, and how we can all move forward together to better serve people living with heart disease, especially those with heart valve disease in this case. So Robyn, let's start with the Heart Valve Disease Council. Can you share a little bit? We talked about what it is, but how does it fit in the broader work of Global Heart Hub, and how is Heart Valve Voice US involved?
Like you said, it's an amazing group of people, and Global Heart Hub has 46 countries represented by 150 different organizations. And we had, I think it was 21 countries represented and about 40 people at the council meeting. And what we do at the council meeting, which is so great, and how it fits into the broader picture. So Global Heart Hub puts together these patient organizations, and we get together to discuss how we can develop programs, resources, how we can support policy across the globe about heart valve disease, specifically for this council. And Global Heart Hub provides the support and provides the resources, the training, and helps us get together to have these conversations. One of the things that we do is we discuss and develop programs that we can then take back to our countries, our various countries, and implement them to help our own, constituents, citizens, citizens of our country, sorry. And because, as you know, heart disease is the #1 killer of men and women across the world. And if we are all speaking with a unified voice, of which Global Heart Hub helps support, we create this unified voice, we go back and we share it, patients across the world benefit. And patients that don't know their patients yet will also benefit. And as for Heart Valve Voice US, we are a member of the Global Heart Hub. We are one of its affiliates, and we help play a key role in raising awareness and outcomes for those with heart valve disease in America. One of the ways we project this unified voice across the globe is with the annual hashtag Listen to Your Heart campaign. And I know we're going to get into that in a little bit, but it's a great way, and it's an annual campaign. I believe it started in about 2020, if I recall. And it's all about heart valve disease awareness. And that this year, it is September 15th to 21st. So you'll hear more about that later. This campaign is also utilized across all social medias across the globe. And so by all of us getting together and by Heart Valve Voice participating, we are able to support patients and learn from others. I think that's one of the best the best things is that we're learning from each other on what works and what doesn't work and the different hurdles.
Yeah. And we're going to come back to that in a minute. Like you said, both the campaign and learning from others in a minute. But one of the things I want to talk about, and you touched upon, is collaboration. Now, collaboration is one of the core values here at WomenHeart, and we work very hard to foster synergy that happens when those aligned with their missions work together to positively impact people living with at risk of heart disease. And to us, this is very important. I know, Robyn, you've expressed this too. Like, our goal is all boats rise. All boats rise. It's not WomenHeart rises and then everyone comes under. It's all boats rise, and that's very important to us. And in fact, we had a great collaboration you and I worked on together on Heart Valve Disease Awareness Day on the 22nd of February, where we co-hosted a webinar called "Could It Be My Heart?" addressing heart valve disease in women. And that webinar is still available on our platforms, on WomenHeart and Heart Valve Voice, so you can still watch it. A lot of people have gone back and watched that. So tell me a little bit about building collaborations and fostering this kind of synergy for you.
I've always been all are welcome in my sandbox. And if Jodi and I have had many conversations about working together and trying to find ways that Heart Valve Voice and WomenHeart, since I'm a member of both organizations, it is one of my key hopes is that we continue to collaborate and find ways to help each other. I also say what's the saying? Work smarter, not harder.
Yes.
And so by combining our efforts and combining our talents, our tools, and our abilities, and then putting it out onto social media, we're able to take the same message that we're both saying and hit a broader audience. The fact that I get to represent organizations in the entire cardiac space, WomenHeart in heart disease for women, and Heart Valve Voice. I mean, heart valve disease affects men and women, young and old. It's not just an older person's disease. And so while I'm out there attending different events and meeting people, connecting with people, listening to the stories, sharing resources, I am always thinking about ways to make the connection, ways that we can support one another. And for example, like what you had mentioned, Jodi, our great webinar in February, and I know that we've talked about some things coming up in the future. I actually do have something in September that I am going with another WomenHeart champion here in California, and we are working and going to a speaker's workshop.
Nice.
Called Your Voice Matters, and it's on September 6th in Newport Beach. If anyone wants to come, please reach out because there is some space available. And we will be sharing materials both from WomenHeart and from Heart Valve Voice. Again, not duplicating the information, but with Heart Valve Voice, we're definitely getting more into the heart valve disease and the valves and the various symptoms. Well, symptoms, that's a whole nother conversation between men and women. So we won't go there right now. I've always been a connector of people and ideas, and I'm just so grateful for the opportunity to be able to help both organizations and keep moving this awareness forward.
Yeah. And things have been moving so quickly, and to have a partner, there's the other quote. It's something like, alone you can go fast, but together we can go far. And,
I like that.
Yeah. And, I think about that because, it's easier to do it by yourself because you don't have to work. There are things about every organization that you have to navigate when you partner. And,
yes.
But we managed to do it and do it successfully. And so, as WomenHeart always is looking for ways we can enhance and expand our message, like you said, by partnering with other people. Can you tell me a little bit? This is going to be off a different question, but how being a WomenHeart champion has helped you in your role with Heart Valve Voice?
Well, historically, I became a WomenHeart champion in 2023, which was about 9 months after my open heart surgery. And a year after that, I became director of patient engagement for Heart Valve Voice US. So it was through connections that I had made as a WomenHeart champion that I was considered for this role. And so right out of the bat, WomenHeart helped me grow into this role. And having the support of WomenHeart that entire first year and since, with the resources, with the Champion Connects, with the different events, going to Advocacy Day, Capitol Hill, going to Capitol Hill and talking to the California legislators, meeting WomenHeart champions from across the country, hearing their programs, what they're doing in their communities. All of it, again, it just kind of just keeps feeding into my brain, and I just store it away as possible future connections, collaborations. And it also, what I love about the WomenHeart connection, one of many, is that because WomenHeart, the champions, represent so many different areas of heart disease, which I didn't even know 90% of the things that I've learned now being a WomenHeart champion and meeting these women in the room. And I never want to discount the fact that I just had open heart surgery. I just had a bicuspid valve and aneurysm, because you're meeting women who've had sudden cardiac arrest. They've been revived multiple times. They've had heart transplants. It's what I'm learning is amazing, but it also helps me because as director of patient engagement for Heart Valve Voice, I am out in the community on a day-to-day basis, speaking with people, speaking with patients, speaking with people that are getting newly diagnosed or having symptoms and they're not getting the diagnosis. I have this whole bucket of toolkit of champions with all these other diseases that I can help refer. I can get some information. I could maybe find resources for these people that I'm meeting. And so in heart valve disease, a lot of times there are heart conditions that will result in some heart valve disease or other conditions, health conditions that will result in heart valve disease. And like for mine, I was born with it. And so but I have a nephew who has muscular dystrophy, a form of muscular dystrophy. And because of his muscular dystrophy and the neurological issues, he now has heart disease. So it's, it all plays together. And I mean, I could talk forever, as you know, about my connection between the two and how much I appreciate this part of my journey in life.
Yeah, it is, but it is when you've been with the WomenHeart champions, you know exactly what you're saying, because the energy, they're so amazing. They're some of the most phenomenal people I've ever met. And I have learned, I worked in cardiovascular disease for 18 years before I came here to WomenHeart, and I'm learning something new every day from our champions. And
so great.
Yeah, them sharing their stories. So I'm with you 100% on that.
Can I do a shout out though, that the support groups that we have at WomenHeart, again, that energy connects over. We do have support groups for people across the country. Some of them are virtual, some of them are in person. And also hearing, and I'm going to circle back to the Heart Valve Disease Council. When we're in those meetings and we're meeting people from around the world, we talk about and we listen to how they're supporting their people. Yes. And the energy is very similar in terms of let's help people. And so I feel like we've got support coming in so many different directions, Jodi.
Yeah, and you're leading right into what I want to highlight next, because we're in these meetings, 20 different countries, 40 participants, and a lot of people will say, well, there's so much still to be done in the US, why are we focusing on global? And we're not focusing on global. We're doing this in tandem. So it is not that. But a lot of people feel like, well, we should just work on everything in the US first. But one of the things I found, and Robyn, you can comment on this as well, is when I'm in the room with all of those people with these different experiences, I feel like it helps me so much in what I do. And like for me, from a program, a development, can I create programs that will be meaningful and fundable to, and can I create partnerships, which is my role. And then with you, very much of a program role. But what I would say is when you hear from countries, some of them have nothing, like some of them have
nothing.
They can't even do awareness for heart valve disease because they don't have any, they can't give people surgery. They can't have the procedures, or never mind TAVR, as it's called in Europe, TAVI. They have no options. But when we learn from them, we learn what they do with what they have. And it creates an awareness in us of, oh, I never thought of that. Like, you could do that. Like, it's like, if we had no smartphones, how would we do things? It's kind of like that, where that information is still valuable. And so I feel like we learn so much about the barriers that people are facing all over the world, to getting a diagnosis, to getting adequate care, and to awareness and education. And I really feel like that helps me immensely in what I do. And I just want to hear your thoughts on that.
The biggest piece for me on that is we have the same hurdles and challenges in any, and I've always said that I live in Los Angeles. I have excellent health care. I was able to get my diagnosis, but I had a long delay in diagnosis, and I had options, and I still couldn't get a diagnosis of endocarditis. This was my endocarditis phase. And when I hear the struggles across the world in these countries that still have the same barriers of delay, access to care, equitable access, it's the same thing. I mean, we have to focus on rural America, right? I mean, rural America here, we want to go out and help everyone. We want to give them wellness tips, and we want to get them doctor's appointments and to listen to their heart and get to a doctor. But the problem is they live in what's being called, quote, the cardiac desert. There are no facilities within 8-hour drives, and, they're not able to access healthier food for a better lifestyle sometimes because they are so far out, or economically they can't afford it. And I mean, there's just so many things. And then when you go to these meetings with everyone from around the world and you're hearing the same challenges, the same barriers, it was eye-opening. I mean, it's eye-opening that here we are in America with the same problems as our friends in all these other countries.
Yeah.
So again, with Global Heart Hub bringing us together, we have this awareness. And maybe your tip, Jodi, when you're talking with people at a table at these meetings, you don't know what tip is going to help them when they go back, right? And so it's like sharing stories saves lives. And now it's a magnificent thing that Global Heart Hub is doing, and that we get to be a part of it and learn from others. We are all using our voice, and as a patient, I'm using it as a patient and an advocate. And there were a lot of heart patients in the room at the council meeting. And so they're dual roles as well. It's amazing. It's just, the experience is really helping. It really is helping all of us develop these programs and understand that we are all in the same boat together.
Yeah. And
in my opinion.
Yeah, and that leads into the next question I was going to ask you. But then we'll come back to the awareness campaign and the other products coming out of our council, and that are really cool. But we had some good conversations about equity and how to, when we're talking about under-resourced and marginalized communities. And again, there are some countries that don't have surgery in most of the country for heart valve disease. You can't get it. It's not an option. So you have to figure out what you do. But we want them to not be left out of the conversation when it comes to valve disease. So can you give me your thoughts on that?
We are working hard to get, we're working hard. I mean, it's a big hurdle. It's a big hurdle to get people treatment that don't have the options, that are not close by. And I still think spreading the awareness and helping them, early detection would be amazing. Early detection for heart valve disease, if we could get that, then we could help people live better without getting the diagnosis at the time intervention is needed. So I don't know. I don't know what the answer is right now, other than we are working on early detection programs and, listen to your heart with the stethoscope, trying to get people aware that heart valve disease, the symptoms of heart valve disease, and a lot of people are asymptomatic. And that's an issue, because those people are not getting diagnosed until usually intervention is needed. Sometimes valve problems are discovered in the ER because you've gone to the ER for another issue and they've heard a murmur. So I'm not sure, and I'm sorry I don't have an answer. I don't know. I just know that we have to keep talking about it. We have to keep the conversation going. We have to keep trying to reach the populations that are struggling, and we've got to figure out ways to help them. And it's I don't know. I'm stumped on that, because I don't know. I've heard stories about people driving 8-9 hours because they think they're having a heart attack, and their closest clinic is 9 hours away. And then it's a helicopter ride because their 9 hours away clinic is not really a heart center, right? So I don't know. It's on our journey, Jodi.
Yes, well, it's something we are all working on together. And speaking of that, I just want to reiterate, and I think we've talked a lot about this campaign, but one of the products that came out of the Heart Valve Disease Patient Council is the Listen to My Heart campaign. And that campaign we've done, as Robyn said, since I think 2020, and it's a really excellent campaign. There are now all the different resources they provide, Global Heart Hub puts together. We all help to create, and then Global Heart Hub puts together in a toolkit videos, and they're in a bunch of different languages, and you can get them customized in language for your country. And there are social media posts and blurbs and fact sheets and all this great stuff. And the goal of that campaign is so that people, the patients and healthcare professionals, understand the need for that stethoscope check. Just like listen, and if they hear a murmur, then
yes,
pay attention to it. Could it be my heart? And
could it be my heart?
Rule that out. And Selena always says, don't let these things be off-road to getting a diagnosis. You need to rule them out first, and then once you've ruled them out, you can be a little more confident. But if you still have symptoms, keep getting checked. And we also have a report coming out at the Unite Summit, which is in November. Global Heart Hub has a big Unite Summit, and there's a report on the journey for women, heart valve disease in women, coming out, that some of us worked on. And that's very, very exciting. So that will be a product of that as well. And then, Robyn, the thing I want to know before we close is, what was your biggest takeaway? And I'm going to end with you, so I'm going to tell you mine first, so we can end with you, and then I'll close this out. Mine from the events, networking with the people from the different countries was huge, but the advocacy training, when we created the whole campaign, a heart valve disease in women campaign,
yes,
piece by piece, and we had that experience of working in small groups and doing that was outstanding.
I felt as though I was in my own MBA program. That was 3 days of of heavy learning, but I loved the fact that they set that exercise up for us, and it took us 3 days to get through with their prompts and with everything. And so again, like you, my favorite part came from those 3 days, other than meeting all these people and just hearing the stories of these of how people live around the world, and how they're making a difference with, like you say, not much, right? And they're making huge differences. And you're just in awe, because we do have a lot of access to a lot of things to do awareness campaigns in America. And when you look at these other countries that don't have what we have at our fingertips, the internet, smartphones, those types of things. My favorite thing was we had to create the program, and one of the steps was discuss it from the viewpoint of every stakeholder in the program, in the process. So the patient, the clinician, the industry funder. I mean, and we sat at the table, I remember, and we just kept talking about all the different avenues. And it was just so collaborative. It was, I don't know, it just opened my eyes that we all have to take ourselves out of our own view. And for I'm a patient and I'm a patient advocate. But now think about it. What does the doctor need from us? I loved that discussion. How can we become better patients at the doctor's appointments, right? And a lot of our organizations are creating resources to help people go to their doctor's appointments more prepared, right? But then the reverse is true. Again, something I heard at Global Heart Hub is how can the clinicians talk to us? How do we want to receive the information? So having that exercise and having the discussion with our group was amazing to try to dissect from each direction. I thought that was super important and very applicable in what we're doing.
Yeah. I loved that too. So we wanted I know this has been a time together, and thank you for tuning in today. And what we know is whether you're in the US or around the world, when we work together, we're stronger. And, the Global Heart Hub Valve Disease Council is helping us think beyond the borders and connect across communities, across countries, which ultimately means better advocacy, better education, and better support for people living with heart disease. So Robyn, thank you for sharing your experience and perspective today. I love seeing you as always, and I love working with you. Thanks to everyone watching. Stay connected, stay engaged, and let's keep pushing for heart health equity everywhere.
I love it. Jodi, it's always a pleasure. I just think we do great. So nice to see you, and thank you for including me today.
Thanks.